Hello, everybody. This is Justin Moore. For those who don't know me, I'm the general manager of Uncle Bobby's. Welcome to our wellness event. Um, it's been a wild ride for Uncle Bobby's if you followed us on social media, but we're happy to be able to still provide resources and do really fun virtual events for everybody, particularly when, we need really good, solid information. This particular wellness event around COVID-19 was inspired with cities and counties and different states reopening with not a lot changing on the medical side. We wanted to make sure that people were getting the kind of facts and the kind of information from the experts, as opposed to politicians, some other folks who may not have the best interest in mind. So we put this event together to talk about how we can stay safe around COVID-19, and I am uh, flattered. I'm so happy to bring on a friend of mine, Natalie McGraw, to speak with us today. Natalie is currently a registered nurse working at Temple University Hospital's COVID-19 unit. She has nearly 2 decades of experience in nursing and also has her degree in social work. Ms. McGraw was recently awarded the Human Rights Award from Westchester University in recognition of her work educating individuals and communities. She has dedicated her life to health and education. So please welcome to the stage, Miss Natalie McGraw.
That introduction. Um, Hearing about myself was amazing. Thank you so much for allowing
Yeah,
me
I
the
wanted to
opportunity.
try to. Yeah, I wanted to try to highlight you. Yeah,
Thank you for allowing me the opportunity to share the information with the public. My
of
objective
course,
is
of course.
to make sure that people, especially our people of color, information from a healthcare provider who's on the front line and who has experienced COVID-19 on both sides.
100%. So what I want to do is, we're 3, 4, 5 months into this, and I still feel like there's still so much confusion around what COVID-19 is from a medical perspective. What is the virus? What does it do? We've heard so much information over these last 3 or 4 months. So I wanted to take a little bit of time to just break down what COVID-19 is, if you can explain it to some folks.
Okay, COVID-19 is a one of a group of coronaviruses, and I see a couple that our audio is not um, to our public. The audio is bad and it's coming in and out.
Yeah, I think it's kind of what I was experiencing in the green room. Your connection is kind of going in and out a little bit, but we might have to power through it since it's not a way for you to really relocate to a different place.
I can relocate. I absolutely can relocate if it's going to help our public. Because if you don't mind,
All right,
I can
I don't
move
mind.
to
We're
a
gonna
different.
make this work. This is
Okay. Does this
We
sound
will
any
make this
better?
work. Just to get you settled. All right, let's give it a shot. Let's give it a
Okay.
shot. Let's talk about COVID.
So COVID-19 is one of coronaviruses. If you remember SARS and MERS from years ago, coronavirus is
Mm.
one of those respiratory diseases. And the origin of COVID-19, according to research, is from bats from a certain part of China. They're unsure as to how the virus was transmitted to humans, but that's where the origin of COVID-19 came from. So COVID means corona, COVID virus. D is for disease, and 19 is the year that it was discovered. So it's primarily a respiratory disease, but if you have comorbid conditions, including hypertension, diabetes, and heart disease, it can affect the rest of your system. Does that make sense?
Okay. It does. It does. I feel like in the beginning, it was, kind of communicated to us that this was just like another version of the flu. It didn't necessarily specify that this was like a respiratory disease. It actually you didn't really use the word disease, right? It was more associated with the flu, and it's just something like kind of like we normally get, or this is something routine. And it wasn't until a month or two in that we realized this was something much more dangerous than just the flu.
Mm-hmm. It is much more dangerous than the flu, because with the flu, although there are fatalities, with COVID-19, once you contract the virus and it attacks your respiratory system, the more it progresses, the higher the risk of fatality. Whereas with the flu,
Hmm.
certain symptoms may cause complications if you have other things wrong with you. But with COVID-19, it's definite. Once it attacks your lungs, there can be fatality.
And one of the other things that we eventually learned about COVID-19 that made it so deadly was how contagious it was. Can you talk a little bit more about how contagious COVID-19 is versus the flu and versus some of the other things we've dealt with in the past?
Yes, with the flu, we already know that it's airborne. So the virus is in the air, and cold weather kind of disseminates the flu virus. So you're on a train, you're on a bus, and it's in the air. However, with the coronavirus, it's airborne and you can contract it in
Hey,
droplets.
Natalie, I just want to let you know, Natalie, just letting we're still having a little bit of sound issues on your end and some feedback issues.
Okay,
Is there a way maybe get closer to the router maybe, or um,
I could I could do that. I could move again. Not a problem. Not a
okay.
problem. So
I just want to make sure
with,
they hear all the information you're giving.
so with COVID, we were saying that it is we're learning more about COVID every day. It is respiratory, primarily from droplets. When you sneeze, when you cough, when you sing, when you talk, the droplets that come from your nose and mouth are infectious, meaning anyone that comes in contact with those droplets can contract the virus from you. So, for example, if I talk to you, Justin, if I was right there, like right there next to you, and I'm talking and your nose and mouth are unprotected, you can inhale my virus and become severely ill. That's one way. The other way is if I sneeze and I touch something, like I'm touching my laptop, and you come and touch my laptop and pick your nose, rub your eyes. Now you have contracted the virus from the droplets that were on my laptop. That's what makes it highly contagious.
Yeah. Yeah, I mean, we heard about the surface stuff, and I think myself, I didn't realize how much I touched my face until, the coronavirus thing kicked in, and I had to kind of quit that cold turkey. And I think I did a pretty good job, at least in public, not touching my face. But
Right.
I wanted to jump into debunking myths, right? There's a lot of bad information out there. So let's jump right into let's just talk about all the bad information. Let's get that out of here and replace that with some good,
Okay.
healthy information that we can rely on.
Okay.
So what myths should we be debunking?
All right. So there is a question right here. Hypertension, diabetes, heart disease is higher among Black people. Is that why COVID-19 is having more fatal effects on Black people? That is one of the reasons. Those are some of the reasons, because these are what they call comorbidities, which are conditions that you are already experiencing that's putting stress on your system. When you contract a deadly disease like COVID-19, and your body is fighting hypertension, diabetes, and heart disease, it puts you at a higher risk for fatality. So that was
Okay.
a question. So I just wanted to answer that question. So the myth that we're trying to debunk,
No problem. No problem. That was a great question.
I have a list that I did my research on. The common questions. People have a lot of questions because they don't have the information, but here are some of the things that people think that are true, that are not true. So the first one is only individuals over the age of 65 are at risk for contracting or being affected by the virus. That is absolutely not true. If you at any age have any of the comorbidities that the person who asked that question, hypertension, diabetes, heart disease, or you're recovering from any type of cancer or any type of respiratory illness, you can contract COVID-19 and have severe symptoms. You can also contract COVID-19 and not have any symptoms. So that's the first myth. Anyone can contract the disease, whether symptomatic or not. The second one is I can contract COVID-19 when I go to the hospital. That is a myth, because the hospital is one of the safest places to be right now, because we have under control our personal protective equipment, and we have testing in place where anyone that comes in will be tested for coronavirus. No matter what you're in there for, you will be tested. The other one is I only need to wear.
Hold on, Natalie. Wait, Natalie. Let's go back to that real quick, because I wanted to touch on something important. Because I had even some personal friends of mine over the last few months that they'd get sick or something happened to them where they normally would have gone and got treatment, but they chose not to get treatment at the hospital because they were scared to get COVID-19. You tell me why that's probably not a good idea to not to avoid getting treatment for any conditions you may have for fear of getting COVID-19?
Because what you're doing to manage your chronic condition on your own without a healthcare professional can cause you to be at risk, more at risk for severe symptoms of COVID-19 if you should contract it. So you need to manage any chronic condition that you have, whether it's through telemedicine with your primary, going into urgent care if you have symptoms, or just just managing how your primary physician advised you to do it at home. So not going to a primary care physician or going to a facility to manage your condition will put you at risk for severe illness.
Right, because if I'm sicker or my body is less prepared, and then I happen to contract it at the supermarket, I have a higher risk of more severe symptoms and possibly making it fatal. So if I'm sick with something, I really need to just get that treated so that at least my body is better prepared in the event that I would to contract that. That makes a lot of sense because I think a lot of people are staying away from hospitals and they're staying away from urgent care. They're staying away from doctors' offices because they don't want to catch corona, not realizing that they might be putting themselves at risk by not doing so. What other myths do we have?
At this point, there are more personal protective policies and procedures in place in every healthcare facility that it is safe to go into a healthcare facility to get treated for any chronic condition.
Okay.
There is a question or comment. I thought there wasn't enough tests available. And I'm glad that that person said that because that is also a myth. Your primary care provider will be able to test you if you have symptoms. And if you go on Philadelphia.gov testing site, you will see a list of places where you can get tested for free. In the beginning, when we didn't know about the virus, when there was uncertainty as to who gets tested or when to get tested, there wasn't enough. But now we have overcome that barrier. There are testing sites. Rite Aid, there are Rite Aids that have testing sites. The city of Philadelphia has a list of testing sites that you can go to that are available for all of us. And thank you for that comment.
Let's continue down your list.
One of the other myths about COVID-19 that I've seen as common is antibiotics can kill COVID-19. COVID-19 is a virus, and most viruses do not have the same construct as bacteria. And with viruses, they usually require antiviral, or they have to just pass on its own. If you remember back in the day when they said, drink a lot of fluid, soup, rest, and that will cause the virus to go away. Pretty much if you have mild symptoms of COVID-19, you isolate yourself, the virus will go away within 14 days.
Hey, Natalie, I have a suggestion for trying to fix your sound. Wait, before you go, do you have like headphones that you would use for your phone that you could plug into your computer?
I do. However, you have to carry on a conversation while I go get it.
I'll do that. I'll do that. Natalie's going to go get her headphones. We're going to try to troubleshoot this real time. Thank you for being patient. Sometimes the internet is not going to participate the way that we'd like it to. I feel like this is one of those versus battles, like where Teddy Riley's sound wasn't right. But we're going to power through this because this is some really critical information and we want to make sure that you have it. Also, I didn't get a chance to say at the top, I kind of forgot. If you do have questions, there's a button below that says ask a question. That's way easier for myself and Natalie to be able to see that you want to have a question asked as opposed to it may get lost in the comments. And if you want to be brought on screen, kind of like if we were in a talk show, if we were on Oprah, you can put hashtag live after your question and I can actually bring you onto the screen to ask the question yourself. just to make it more interactive. It's totally optional. You can do that if you want. And Natalie is back. You got your
seeing
headphones?
faces. Yes.
Okay, it's all okay.
Yep.
It's plugged in. You're good to go. Okay, awesome stuff. Okay, I think we're
I'm good to
we're
go.
good. Let's keep going down. Let's debunk some more myths. What other bad information do we need to work on?
The virus will die off when the temperatures rise in the spring. No, the virus is not going to die off because the weather's getting warm. The virus is going to die off when we stop having person-to-person contact that transmits the virus. The virus is going to keep going as long as it's being transmitted. So imagine you have your
So
lungs.
the weather has nothing to do with it.
It doesn't have 100% to do with it. Like the flu virus is killed pretty much. Most of the flu virus is killed in cold weather. This is one of the reasons why we have had a fulmination of the flu when we don't have severely cold winters. Now, we're learning a whole lot about COVID-19 at this point. So to say, yes, when the spring comes, it's going to go away is a myth because we don't know. What we do know is person-to-person contact is how it's transmitted. And as long as we keep congregating without masks, without proper hand washing, the virus is going to keep going. So that is a myth. All right, the other myth that I do have is everyone with COVID-19 dies. I contracted the virus and I'm here. There are a lot of people.
Okay. Yeah.
There are a lot of people that have the virus and are not symptomatic, which means they're walking around and they don't feel it. But what they can do is transmit it to someone else who have all of the conditions that one of our audience members pointed out: hypertension, diabetes, and heart disease. And they can have severe symptoms and they may end up dying as a result of complications. So that is a myth. Not everyone dies because we have
Okay.
a
Well,
lot of people.
before we move a little forward, you just said you had COVID-19. That's a bit of a
I
revelation.
did.
Like, can you talk a little bit
Oh
more
my
about
goodness.
your experience having it and what that was?
Let me tell you, I usually don't get sick. That was the worst experience of my life. I'm not being dramatic. It really was. Um, I contracted it from work. I worked in the COVID hospital at Temple. And at that time, COVID-19 was new. We were just figuring out the personal protective equipment and all that. So we were not 100% protected. 2 days after my last day of work, my eyes hurt. I started getting a cough. After that, I checked my temperature because I started getting chills. It was 103.9. And it was downhill after that. And for exactly 14 days, I was sick. I lost my sense of taste. I had the fatigue. I had the general body aches, loss of appetite, um, fever, cough, shortness of breath. I spent 2 days at Einstein and I said, don't put me on the vent. Don't care what y'all do. Don't put me on the vent. Came home and isolated myself and I recovered. On the 14th day, the symptoms started to subside. So that was my
Wow.
experience.
Wow. Well, I am really glad
Yeah.
you are back on your feet and fully healthy. And I think that that highlights an important part because one of the things I think irritate me currently is reckless people have been with their decision making from day one, even today, being out, not wearing masks, going into stores, not wearing masks,
Hmm.
not taking the necessary precautions to keep the people around sick. And then they come into Temple University Hospital sick and you have to treat them, which puts you and all the other frontline workers at risk. And,
Hmm.
the fact that you contracted it trying to help other people, highlights just how much more we need to do to keep each other safe throughout all of this. Um, that yeah, I'm glad that you back on your feet. A lot of people come this disease didn't make it, so I'm very glad that you're
Me
you're
too.
healthy again and smile.
I'm glad I lived. So, um, if you
So I
contract,
actually want um, we have a couple questions actually that we have a couple questions I wanted to touch on really quickly that were similar to
okay.
what we discussed. Kristen asked about the tests at CVS, and she
Mhm.
talked about the questionnaire that CVS gives you, and they only want to give you the test if you're showing symptoms or if you had contact with people who has symptoms. Do you know of any testing available for people who just want to know their own status? Perhaps they're asymptomatic and they want to know if they can give it to their parent or grandparent. Is there any way you can get a test if you're not showing symptoms or haven't been in direct contact with somebody?
If you go on the cityofphiladelphia.gov um, backslash testing sites, there are sites that you can go in to that doesn't require you to have symptoms. So, as for primary care providers, they have to order those tests and it costs money. So, it's really a lot about money as well. But the city is offering testing and they will take your insurance information so that they can get it paid for. But the city sites, you don't need to have symptoms to get tested, especially now since we have had the protests and people congregating in large groups. They want anyone who has been in contact with a protester to come in and get tested at least 7 days after being in contact with a protester. So they're not going to expect you to have
Okay,
symptoms,
okay, that's
but they
helpful.
want you to get tested.
Well, considering what the city of Philadelphia was doing the last 3 weeks, that's a lot of people that's eligible to get a test, and hopefully folks are
Yeah.
able to know their status and know what's going out there. We have one more question related to what you talked about earlier about hospitals and medical facilities being some of the cleanest, safest areas you can walk into. Mandy had a question about specific. She said she has a physical that she needs to get for whatever reason, and she wants to know what are the precautions that are being taken at some of these health facilities so that she knows when she walks in there she will be taken care of and not contract the virus.
If they don't test you, just request a test. So most of the
No, I think this
facilities,
was this was about being. I think this was about what the facilities are doing to stay clean and sanitize. And so, if I walk in for whatever reason to get a physical or for something else, what are they doing to make sure the disease isn't being spread within that clinic?
so in my experience, the clinics that I've been to, and I've been to the Veterans Administration Medical Center, they test your temperature as soon as you walk in. They give you a card to ensure that you have been screened. And then they only allow a certain amount of people in the facility at a certain time. And then they have separated seating areas within 6 feet. And they have sanitizer stations just about every 10 to 20 feet. And there are people who provide housekeeping for anyone who has been in a facility They sanitize the seats. They sanitize anywhere that members of the public have come in contact with. So that's what I have seen so far. And you are well within your rights, if you don't see that happening, to say, are you going to sanitize the seat? Or ask, has this area been sanitized? You have to protect yourself.
It makes
I
sense.
see there's
I do want to keep going, but there was a
a
question in the comments, and yeah, and it's related to one of the myths you talked about, related to vaccines and treatments that have been out in the news about things that kill
Mhm.
COVID, things that cure COVID, that's gotten a lot of people in trouble. So can you talk a little bit about the myth about vaccines and where we are in that process?
The vaccine is still new, and with any medicine that is new, there must be a time period for observation of side effects. In most cases, in most research cases, the time period is 5 to 10 years. If they are pushing a vaccine next year, we don't have that 5 to 10 year window to observe side effects. We have to do our own homework. We have to make sure that we go on the sites, the research sites, any research site that ends in .org, .gov, .edu are reputable sites for information regarding vaccine progression. I can't speak on the vaccine at this time because there's not enough research. There's not one created yet, and there's not that 5 year window for side effects. There are human testing being done, but there are no conclusive evidence of side effects. So it's a wait and see, and it's up to the individual to do their own research to make the decision whether they want to get the vaccine or not.
I think that's helpful because what we kind of seen in the last 6 weeks is some little piece of information where there's been some case study that there was a little bit of positivity, and then it's all over the news that we're like so much closer to this being treated, and that seems to only come from one kind of direction, and people that really want to hurry up and have their reputations politically look better. But it seems like all medical professionals are saying what you're saying, which is we don't have enough information to say anything um, clear about it yet. We need more data, we need more time, we need more testing, we need more case studies in order to make
Mm-hmm.
a determination of whether or not we have a vaccine. And I think just
Mm-hmm.
telling people the truth that we don't have this miracle drug, we don't have this magic pill that's going to save everybody overnight, and that this is a process. And during that process, we need to stay safe and still make the smart decisions to try to avoid this while the experts try to work on a vaccine. So yeah, thank you for that.
You're welcome.
um, I wanted to jump into so let's say I start feeling sick, right? And I get some symptoms. I get a cough, I have a fever, because I have a 4-year-old at home, and you get sick from your kids all the time. So I guess at what point do I need to go to a hospital to seek medical attention? How bad do the symptoms need to get for me to go get it treated?
When you have a fever greater than 101.1, when you get shortness of breath, when you get chest pain, and when how you're feeling is different from something you felt before. So, for example, most of us have had a cold with that cough, annoying cough. We've had a headache. 9 times out of 10, it's not both at the same time. So, when you're experiencing symptoms that are different from what you've experienced before, and shortness of breath, because that's a classic sign of COVID-19. that's when you need to seek medical attention.
Okay, that's good. Because I mean, even me, I didn't know.
Hmm.
Thankfully, I haven't experienced any symptoms since any of this started. But if you cough a couple times in a day, you have to, immediately rush to the hospital or something like that. Um, but one of the things that excited me the most about tonight was that you've been on the front line, that you have treated people with COVID-19. Because what I haven't seen anywhere is anyone describe what that experience is like if you get COVID-19 and have to be hospitalized. You hear the horror stories when people don't make it, but just, we don't hear what the experience is day to day. People spend weeks and weeks and weeks in these hospitals
Hmm.
and no one knows what that's like. So I really want to spend a little bit of time, pulling back the curtain a bit and shedding some light on what the experience is like if you do contract COVID-19 and have to be hospitalized. So can you speak to that for a little bit?
So if you come in via the ambulance, do not pass go, do not collect $200. You're going right into a room where the staff is going to be in hazmat suits isolating you. Before you get to a bed on a unit, you will be in a bay in the emergency room. No visitors can come with you. So your family members can ride behind the ambulance. You have primary care by one nurse. So you won't be able to press the call bell and expect different people to come to your aid because there's just one nurse or one healthcare provider that's going to be caring for you. Um, your food is going to be delivered in a paper tray with disposable utensils. Everything that you have to do is going to be done in that bay, right there. If you have to go to the bathroom, right there. If you're sick and you have to vomit, right there until you get a room. When you get a room in the main hospital, same thing. You're in that room, everything's right there. Um, your phone that you're going to use, that's going to be it. If you have long distance calls to make, you won't be able to contact your family and let them know that you're there. Um, the TV service is not free. So if you didn't bring money to pay for the TV service, you're not going to be able to get it. Um, Poor hygiene is one of the things that you may experience if you're going to be there more than 3 days. We don't change bed linens. Your linen that you're going to be on, you're going to be on it. Except if you go into the intensive care unit, they make sure and they turn you and reposition you because you're going to be ventilated. And that's different. But if you are able to walk and talk in your room, we're not making your bed every day. And if you don't go into the bathroom to do your own personal hygiene, no one is coming in there with fresh towels and fresh washcloths and all of that for you. There is a risk for anxiety, depression, because you're there by yourself. Your family can't visit. And there are instances where nurses have specialty phones to be able to FaceTime your family, but that's not upon your request. That's only if you are severely ill and family need to come in. So it's real isolation. It's real isolation, and it's it's not a pleasant experience. For those of you who have been in a hospital and have had great healthcare providers, they're still great, but you're going to be by yourself without all of the other experiences that you've had. The dietary department, they're not coming in to ask you what you want to eat. Whatever they give you based on your condition, if you're diabetic, whatever that diabetic diet is, that's what you're going to get. Um, Everything is disposable, and it's very isolating. We try our best, we really do, but at the same time, we can't visit you as often because we're putting ourselves at risk as well.
Right. That's kind of the tough right part because I know as a
Mm,
nurse, like if you've ever been hospitalized for any reason, like the nurse is your primary point of contact. They make that experience better, with the bedside manner and checking in on you.
yeah,
But like you just said, every time you walk into that room, you're putting yourself at risk. So to protect yourself, you have to, kind of be colder and not, interact as much. So knowing that, okay, I'm going to the hospital, I'm isolated until I'm discharged. What should I bring with me to make sure I can lighten the load mentally throughout this thing? Like, what should my be in my go bag before I walk into those hospital doors? Considering I can't get anything in or out once I'm in.
so here's your COVID-19 survival kit items. Absolutely, if you don't take anything else, your cell phone and your cell phone charger. We don't have phones for you to use. You do have the bedside phone, but it's limited to just calling. You can't text, you can't FaceTime, you can't do anything else with those bedside phones. If you bring your phone, we don't have chargers to give you. So you need to make sure you bring your charger with you. We have had experiences where family members said, "Oh, my cousin Mookie is bringing my charger. Can you go get it?" Guess what the answer is? Absolutely not. We are not leaving the unit to go downstairs to get the charger to bring. That's cross contamination, and we're taking time away from our patients. So you definitely need your cell phone and your charger, personal care items, toothbrush, toothpaste. We have all of those things, but a lot of people don't like it. So you bring toothbrush, toothpaste, change of clothes, and if you don't know your medication by heart, all of your medication with you. Unless you're going to the hospital where they're known to you, that they have a list of your medication already. So that's the survival kit. Definitely the cell phone and the charger.
Um, I guess you should bring a good book with you, and there are books for sale at Uncle Bobby's on if you need to bring a book with you to the
Yes.
hospital, help pass the time. Um, just curious. I'm a big TV person. Are the rooms equipped with televisions with some type of cable service? Is that something that I would be able to have access to if I were in one of these rooms for 3 weeks?
$9.10 per day, and you have basic cable service at Temple where I work. We don't have HBO and Showtime, and we don't have that. We just have USA, TBS, the premium channels. We don't bring the newspaper in. Um, so yes, read the material, and you don't think about all of those things when you're sick. So
Right.
if you grab those things as you remember it on the way out, great. But if I could stress, definitely your cell phone and your charger so that you could communicate with your family. I mean, there's nothing more healing than being able to
Yeah,
talk
that
to your
makes sense.
family.
Thank you for all that. I this is news to me too. It was this huge question mark, and I think there's a lot of fear and anxiety, that still exists about what it's like if you get hospitalized with COVID-19, and obviously this isn't great news to know that you'll be completely isolated and you won't be able to speak to
No.
any of your family in person for weeks. But I just think it does paint a little bit of a picture. So at least I know what I'm getting myself into, and I know what I'm bringing with me before I walk
Mm-hmm.
into those doors to at least make this as easy as I can. But let's talk about it, right? Philly is in yellow. whatever yellow means, but we can now be outside again. We can now visit retail shops. I guess I'm going back to the Gap to get a pair of jeans after 3 months. I'm not quite sure, but we need to protect ourselves in public. So what should I do? What should anyone listening do to make sure we're being protected in public now that we're free to go back outside again?
One of the things that you have to make sure that you have a mask that covers your nose and your mouth, because those are the portals of entry. Yes, very good, Justin. Those are the portals of entry for the virus. Your eyes also is a portal of entry, but only if you rub your eyes. So you have your mask and make sure that you have hand sanitizer. So you go out, you go to the store, don't be afraid to touch stuff. As long as you don't touch stuff and rub your nose and mouth. You don't need to wear gloves, because what happens is you're touching items with the gloves anyway. You're touching yourself, you're touching items in your bag, you're touching your wallet. So the gloves aren't giving you any more protection than your hands. So you go into the store, you exchange money, you touch the items, and you're out of the store. Before you get into your car, or if you're on public transportation, before you get home and touch the surfaces that are known to you, your familiar surfaces, you sanitize your hands. And when you get into your home, wash your hands with soap and water, remove your mask, wash your hands again. That's the most important thing. Face covering, hand washing. So don't be afraid to go out. I mean, we need that for our mental health. Social distancing is very important as well, because if I may, without being graphic, imagine you're walking behind someone, right? And they pass gas. If you can smell it, that means that you're too close. So that's what the social distancing does. That air that's coming out of their nose and mouth, you're going to be inhaling it between 4 to 5 feet. So keeping 6 to 8 feet from someone protects you from their air, from their nose and mouth. Everyone needs to be wearing face coverings when they're outside. Unfortunately, I have seen not everyone is doing it. So protect yourself from the air that's coming from the other person, especially if you can't be more than 6 feet apart from people. Does that make sense? That's what we need to be doing if we're going to retail stores and areas that are enclosed. Restaurants, supermarkets, um, retail stores, anywhere that's enclosed, that's what we need to do. Okay, Justin, I can keep going. All right. So the other point that I have is, how can you protect your body? So if you are relatively healthy, and relatively healthy, I mean that you're in an optimal state of health based on what you and your primary care provider have been managing. Um, you need to eat right. You need to engage in some type of exercise at least 3 times a week. You need to drink water, at least 6 to 8 glasses of water every day. You need to get adequate sleep. And what that does, what all of those things do, is nourish your immune system. So your immune system is a big deal. It's part of your body. It's not just something that we pulled out of the air. my immune system is working, my immune system is bad, my immune system is fighting. It is an actual system of your body that needs the same amount of attention as your hair, your skin, your nails, your lungs. Your immune system, even though it might seem invisible, is all throughout your body. So you need to feed your immune system for it to work properly, just like you need to feed yourself. If you don't eat properly, you get weak. And the same thing with your immune system. So we need to stay away from high fat foods, foods that are high in sugar and empty carbohydrates. So we're talking about lean meats, fruit, vegetables, and protein. Whether you are a meat eater, vegetarian, vegan, you need to nourish your body with foods that are high in nutrient content. You need to drink a lot of water to flush your immune system out because what your immune system does is take on viruses and bacteria and it needs to get rid of it. And how it gets rid of it? Water. It has to flush it out. So those are some of the ways that you can keep your body healthy to prevent symptoms of COVID-19 and also strengthen your immune system to be able to fight it. The other thing that I do have to mention is the city of Philadelphia is doing a great job with updating on statistics about COVID-19, how we're progressing from the red to the orange to the green phase, the areas that are open, the facilities that are going to be open, and what you need to do to protect yourself. So I would suggest any one of you, and it's free. The information is free. Go on cityoffphiladelphia.gov backslash COVID-19, and you'll get daily updates on what the city is doing to combat COVID-19, the most recent statistics. As a matter of fact, I do have the most recent information from the mayor today. As of today, there were 116 additional cases of COVID-19, 21 additional fatalities today. All right. Mandy has a question. What about hanging with friends and family? Yes or no? If we do we self isolate if we do? Absolutely hang with your friends and family. Um, for our mental health, we still need to connect with our friends and family. Um, the ones that are closest to you, maintain your closeness, meaning, your cousins, your friends who prior to the pandemic you were close with, not distant relatives twice removed. They need to continue to be twice removed, but your immediate family, friends down the street, make sure you're wearing face coverings, make sure you're socially distancing, and if you touch each other, if you shake hands, just make sure you wash your hands. Um, Celeste, I'm a natural therapist and I'm encouraged concerning the anti-malarial herbs being sold in great numbers, especially to Germany. At this point, there's no evidence that the anti-malarial drugs are effective in preventing, treating, or curing. So taking in, whether it's natural or osteopathic drugs, you're putting more stuff into your system that you don't need. So with a virus, with any virus, taking care of your body, fluids, rest, and social distancing, hand washing is the best way to combat COVID-19. Um,
Okay, Natalie,
yeah,
do you see me, Natalie? Am I back on with you
I don't
guys?
see you. I hear you.
I'm not quite sure. You don't see me. You
I
hear
don't see you,
me.
but I can hear you. Yes.
Uh, well, okay. Well, as long as you can hear me, we do have some questions that I wanted to make sure get answered. Celestia said she wanted to know why a vent application is so strongly a negative thing. I'm not sure what a vent application is. Do you know what that is?
I did not hear the question.
Uh, can you hear me now?
I can, but there's feedback.
Sorry about that. She was asking about a vent application and wondering why that was such a negative thing.
I am not familiar with a vent application. It's not something that we use in the hospital. So unfortunately, I'm not able to answer that question. And if it has anything to do with mechanical ventilation, that's within a hospital setting.
Okay.
So if she can
We have
clarify
another
the
question from
question,
Mandy. Oh,
if she can clarify the question, maybe I can answer. You said that you said
okay.
a ventilator.
Yeah, in the question it said a vent application, not a ventilator. But we'll wait for Celestia to try to clear that up in the comments. Let's move on to Mandy's question about social distancing. It's a concern about social distancing even around family. Can we
Mhm.
hang with friends? Can we hang with family members? Like what should be the social distancing rules around the people closest to us?
I kind of touched on that question. For your mental health, you still need to connect with your close friends and family, not people that you haven't seen in a long time, people that you have been close with prior to the pandemic, but you need to maintain social distancing. You need to hand wash and you need to wear a mask, even with family. And in this time, we're in a pandemic. I'm quite sure everyone will understand if you tell them, I would prefer if you wear a mask when you come visit me. And you can enjoy a visit, feeling comfortable that, no one is spreading anything. Does that make sense?
Yeah, that makes a lot of sense. And I am pro mask in social
Hmm.
situations. I will sit in your backyard with a mask all afternoon long.
Hmm.
Um, Colleen has a question. How do you feel about outdoor dining areas at restaurants? That's a big thing here in Philly now and a lot of places.
Hmm.
So what are your thoughts about outdoor dining?
In the air, the virus has more of an area to disperse. So if you were inside a restaurant, the four walls and the windows, the virus is circulating within the four walls. So being outside, it's a better environment for the virus to disperse. So for example, if you're sitting across 6 feet across from a person who has the virus, it's going to disperse into the air as opposed to right in that circle. It's being exchanged right across the table. The waiter is coming to deliver your food. So there's more of an area for the virus to just be away from person to person contact. So I'm all for outdoor dining as long as it really is outdoor. I've seen on the news where you have people still packed in an outdoor space. That's not safe because you have people still close to each other. So you have to maintain 6 feet table spaces apart, like each way. East, west, north, south has to be 6 feet apart. And you can't crowd tables with people, that's just as dangerous. Celestia, when I said that I didn't want to get on the ventilator, that would have meant that the virus has pretty much infected my entire lung. And when you get on a ventilator, it's a lot longer for your lungs to actually do its natural thing. Because when you're on a ventilator, they put you in a medically induced coma and you're unaware of anything until they take you off of the ventilator. So that was just a personal statement for me. Whatever I had to do, I didn't want to be on a ventilator. So that's why I said, if that means that I needed more oxygen, I needed to sit up, I needed to walk around to open up my lungs for it to do its thing to get the virus out, that's what I needed to do. But for people with comorbidities,
So no,
people with
I
lung
was saying, so do you
problems,
recommend that all of us should do that?
all of us should.
Like, should all of us kind of avoid the ventilator? Should we avoid
If you
getting on a
have
ventilator?
underlying
Wait,
underlying respiratory issues, you need ventilator support because if the virus attacks your entire lungs, you're not going to be able to breathe. So you're going to need ventilator support. So no, I would not recommend you telling the healthcare providers that you don't want the vent. As a healthcare provider myself, I understood the risk if I didn't and I needed it and I was willing to take it.
all right, we got time for one or two more questions before we go. We got a question in the comments section from Hutch. He asked about once gyms reopen, what precautions should people take when exercising or if they're swimming in a pool? Like, what should we do?
So the gym owners should be following CDC guidelines, which means that they should only allow a certain amount of people in the gym at one time. And after each person has utilized the equipment, whether it's the stationary equipment or the free weights, there should be staff that sanitizes the equipment after each use. So you have to pay attention. It's your individual responsibility to pay attention to the sanitizing procedure of the gym. Um, and your comfort level. Do you want to go into a gym that's closed in, you know, with people that are breathing, you're breathing hard, and 9 times out of 10, they're not going to be fully wearing their mask because it's difficult. It's very difficult to perform strenuous activity with the mask. So you're going to have people who are going to be taking it down, breathing hard. You take it down to drink water. So it's entirely up to the individual. I would recommend making sure you know of your gym's policy on their sanitation and the amount of gym members at a time before you go in. Swimming, you cannot
Awesome,
contract the
thank you.
virus in a swimming pool.
Go ahead, yeah. Yeah. Oh, no, no, no. So swimming is okay?
Swimming is okay. However, you have you have to remember when water gets into your nose, what do? And then you touch, yeah, and then you touch the side of the pool. You touch any area after you get out of the pool, and that is an area of your body that the virus is harboring in your nasal passage with your nasal secretion. So even though you can't get the virus in the swimming pool, your concern should be outside of the pool itself. Does
Okay,
that
that
make
makes
sense?
that's a natural kind of thing when you're
Mm-hmm.
swimming and water and you
Mm-hmm.
go around. Yeah, it makes a lot of sense. And it's even more diligent about not touching surfaces and then touching your face again. So I guess bring in multiple towels with you, I guess, to make sure you're wiping your hands by the side of the pool before you get out. I think that makes a lot of sense. Uh,
Mm-hmm.
we got time for one more question. Does anyone have any questions? I Uh-oh. Did we lose Natalie?
No, I'm still here.
We have had some internet issues all night, so we apologize for that. Well, I
I'm still
hope
here.
Natalie is able to jump back in so that I can thank her for joining us.
I am
Um,
still here.
I hope you got some helpful information, particularly about the experience in the hospital. That was something I was excited to be able to share because I think that's a really key component to hopefully dealing with some of the stress and anxiety around COVID-19 and contracting it. I want to thank Natalie again for taking her time out to share information with us. If you miss anything or you want to watch this again, this link will also show replays. We'll also have the video uploaded on our YouTube page. So you'll be able to get some of the information and the resources that Natalie shared. We'll be back tomorrow night at 7 o'clock on the same Crowdcast feed with therapist Shashina Bray. We'll be talking about mental health and all the stress that we've all been dealing with for the last several months for so many different reasons. And mental health isn't addressed the way that it should. We get sick, we start having symptoms, we go to the hospital, we go to our doctor. But when we have stress, when we have so many things going on in our mind, we kind of just deal with those in the worst ways. And we need to get the same type of professional help sometimes for our mental issues that we do for our physical issues. So I'm excited to bring Shashina on tomorrow to talk about mental health. So please come back, bring your questions. She really wants it to be super interactive. And if you want to come up on the screen and ask the question yourself, that's also an option. We'll see you tomorrow at 7. We're going to work real hard to avoid any technical issues and stay tuned. Follow our Instagram page and social media, our newsletters for updates, and we'll see you tomorrow.
And thank you for having me.